Hi guys, welcome to the Two Docs Podcast. I'm Dr. Ingky.
I'm Dr. Amelia, and welcome to the podcast whereby two doctors, generally the two of us, talk about non-medical stuff. But as last week episode,
Yes.
we are obviously the $4 docs now, and it's in
It's in conjunction
of cancer
awareness. Right. So this is Cancer Awareness Month, and the theme for this for today's episode is we'll be speaking to two doctors, two medical doctors, Dr. Amelia and Dr. Aiesha, who are cancer survivors, and we're going to ask their opinions of how do they cope being a doctor and a patient at the same time. All right. So I think my question is to Dr. Amelia. How do you? Because there's a very common term among doctors is doctors make the most difficult patients. As a patient, how do you turn off that part of being a doctor when you see your oncologist or your doctors? Do you turn it off, or is it still switched on and you tend to negotiate with a doctor?
The answer is very difficult to switch off. So I think my oncologists and breast surgeons, they have difficulty in dealing with me because every time when I go into the room, I dictate what to do next and I will repeat what I want instead of what they advise me to do. Yeah, so and a lot of times, me being a patient at the same time also a doctor, when I manifest my emotions to them, I allow myself and they allow me to prolong it inside the room. Yeah, so I would show my emotions more and then tell them what I want. When they tell me their opinion, I try to counter. That's what happened in my cancer treatment journey. Yeah, but I also learned that sometimes I consciously told myself when I went to see my doctors, I need to switch off this role because I'm really a patient to them. Yeah, so to answer your question, it's very difficult. Yeah.
For you, Dr. Aiesha, were you a difficult patient?
I would say that I'm 50-50. I thank Dr. Amelia for her honesty, but honestly speaking, I'm able to switch off my doctor role because I like to do it behind the scene. But when I went into the doctor role, I will have a listening ear. I will flex my listener and patient mode, and while waiting for the explanation. And then I would say if this opinion resonates with me. And my next question is there other options? So I'm not sure with Dr. Amelia, but for me, before I go to the doctor office and during the waiting time, I will list down all the questions that I want to ask. So usually there will be 10, 15 questions that I want to ask. And I'm lucky and blessed to have very good doctors. And if I wrote down like 15, 20 questions, she probably have answered 15. And I left only 5. And that, I'm good. So I'm able to switch off my doctor role, but at the same time, I'm not able to switch off my doctor role outside the doctor office. I will go hunt for the latest papers. I will go hunt for the latest technology. And now we are talking about cancer vaccine. So do you know about the cancer vaccine? HER2 positive breast cancer patients, they're developing a vaccine. And this news, I knew about this years before because I hunt for this news. And there was this big platform. I don't know if you guys ever heard about this movement of curing cancer. I can't remember. Do you know about the movement like cancer or something? Yeah. So one time there was a big movement, a worldwide movement to end cancer. So they developed this foundation, and big artists and celebrities all over the world came together to develop this movement, and they had big money, and this money channeled into research, cancer research, and that is why now, like 10 years later, Dr. Amelia able to enjoy all the new stuff that is from the old movement. Yeah, so do support all this foundation, because most of the foundation, they channel it to research, and then it will be paid off. Maybe you can see the result maybe 10 or 20 years later, where they have like a new trials and new vaccine, and we are going to talk more about prevention.
Dr. Amelia, I want to ask, an advice for new cancer patients or someone who's just recently diagnosed with cancer or someone undergoing their cancer treatment journey. How would you advise them to cope or to deal with the stress on a regular basis? Or how do you deal with your stress on a regular basis?
I think this is very much related to the person's character and personality, because my journey was impressive to a lot of people as they tell me, but I myself don't find it impressive or amazing, because I was just being myself. So originally I have been someone who is very positive, cheerful and optimistic. So when things hit me, whether it's cancer, whether it's accident, whether it's something difficult in life, I don't allow myself to dwell on the problem too long. So I often focus on solution. So a little bit similar to what Dr. Aiesha shared, when she was diagnosed, she started to think of strategies and plans. So that was what happened to me also. But although I admit that I did have that emotional moments for about 7 days, and then I actually put aside the whole thing and went on with the treatment without thinking negatively. So my tips for everyone would be not focusing on problem, but focusing on the solutions and just go day by day and not think of too far. And if you have friends, if you have family, talk to them, tell them, don't be shy. So for my case, the moment I got diagnosed, I think in less than 24 hours, I made a post on this very big platform on social media, on Facebook, which is the breastfeeding group that has like thousands of mothers inside. Because at that time, I was still breastfeeding, just stopped breastfeeding. I posted this post to tell all the mothers out there that I was just diagnosed when I was breastfeeding. Because most people know that when a mother is breastfeeding, the risk of getting breast cancer is lower. But in my case, I developed breast cancer during breastfeeding. So when I don't shy away from problems or issues in my life, I find it more comfortable to deal with the problems. So I think that is one important tips. One of the important tips for everyone is to not shy away from problem. Yeah.
Dr. Aiesha, during the course, of course, there are down days, up days. How do you perk yourself up? What's your magic potion or your recipe? What do you do to perk yourself up and to change the day from gloom to bloom?
So there's this thing where I like to look at the clock, as I said with my thought, and the clock go 1, 1, 1. So I like progressive and forward moving. So let's say when I walk, things are moving forward. And when I was dealing with chemotherapy, I saw from 5 p.m. to become 6 p.m. Hey, I'm 1 hour less misery now. Like we are almost towards the finishing line. So when you think of the treatment will last not forever. So my mindset is about the hard times is not going to be forever. There is a finishing line. So you have to endure it and use all sort of strategy to get to the finishing line. So once you get to a finishing line, this is a time of celebration. So what I did during the tough time is that I can't exercise and I can't do nothing. I just sit in my bed in pain, in misery, and I turn on a comedy show because laughter is the best medicine. It also helped me distract my own pain. So mind you, I was having this cancer chemotherapy protocol that caused a muscle spasm. So each and every muscle in my body went into a painful spasm. Even this little tiny bit thumb, like all those muscles that you don't know, it's so small, you never care about it. Even the little eyebrow is twitch and spasm. And when I mentioned to my doctors, I have already maximized my current pain medication, and the doctor's final decision is continue the same. So now I'm 100% using my psychological tactic. with the pain gate theory system, So thank you to to all the comedy show. I would recommend 2 comedy show. One is The Modern Family. It's like you need a really simple, silly comedy show that doesn't require a lot of brain processing thing. And the second thing is Little Britain.
Little Britain is fine.
Little Britain is funny. Or something like Mr. Bean, because we have all this mental fatigue, physical fatigue, and pain. I believe this is the thing that helped me, and thank you to those people who bring out those silly series. Yeah.
All right. So final question to Dr. Amelia. What do you wish other doctors would know or would do for their cancer patients, since that you are a doctor and you've already been through the diagnosis?
Recently, I heard this sentence from one of my clients, patients in my own clinic. She said that for doctors to see the same conditions, it may be many times or hundreds of times, but to that particular patient is one and only time that he or she is experiencing. So I think this scenario applies to our case as well, that when we see our oncologist or breast surgeon, maybe they are seeing so many other patients the same day, but to us, we only have them. So treat every patient as if, you see them, you treat them, you feel them for that one and only time. I think that will be my wish for all doctors out there who treat their patients.
My final question, Dr. Aiesha and also Dr. Amelia. How has your perception of life changed?
My perception of life has changed after I have my cancer diagnosis, because I realize life is short. We have to live it in a meaningful way. We do not want to waste time, and there is a sense of urgency. Therefore, I keep myself fit and strong so that I can have quality of life. And all problems have solutions. Because I have this sense of betrayal that my body gives me, it helped me find my own way, where I found bodybuilding to feel safe again inside my body. And through my trauma, I leverage it to achieve something more. Because trauma, if you use it wisely, it can be like this special power inside of you to achieve something big beyond your imagination. So if I were not a cancer survivor, I am healthy, fit and strong. Where is my drive to achieve big things at such a young age? So when I went into a bodybuilding sports and achieved 3rd place in NABA Universe, it makes me think, if I were not a cancer patient, it's almost hard to have that drive, because I feel like I want to leave something behind. I want to leave a legacy. As someone who lived with grief, and you have to know that you will be forgotten. So each one of us here live a temporary and short life. And most of us will be forgotten. Yeah, people will be sad day 1, day 2, and then they will not remember you anymore. The earth keep on spinning, and people will continue their life just the same when you were here, So in that sense, how do I make my legacy intact forever? So one is to get into a coaching business. So I give my knowledge to others so that I live my life through other people. And also to appear in the podcast of the 2 dogs, because once it's out there in the internet, it will forever.
And now your toys are. When you want.
So,
No, I think she wants a little bit first. I thought what's her own back.
so
Yeah. 2 plus 1.
and also when I venture into sports, once you win something, it will be part of a sports history. You will never die. So, I'm in the database, 3rd NABA Universe, 3rd place NABA Universe 2022. So, the earth will never erase me. I will be here forever. So, I can die tomorrow, I can die next month, next year, who knows? And I try to be as meaningful as possible and enjoying life to the fullest. do not postpone what you want to do. You want to travel, go for it. You want to take risks in life, go for it, but make sure it's a calculated risk.
Well said, well said. Dr. Amelia?
Whereas for me, I tell people this all the time. It doesn't change much of me because before my diagnosis, I was already someone who thinks life is very short and I went all out for things that I wanted. And most of the time with this character, with this personality, I almost achieved all the things that I wanted. But it's true that after the diagnosis, I make it even faster because we really don't know when our last day is, and I try to achieve things even faster. So in my case, it doesn't change much of me.
So I think the take-home message that I learned from both of them is enjoy your life, live life to the fullest, and do not wait.
delay.
Yeah, don't wait.
Do not delay.
Do not wait for tomorrow.
Yeah, because tomorrow may never come.
Yes. Yes.
Correct. So they always say tomorrow is an empty promise.
Yes, that's right.
Because you're really not sure. Well, anyway, we hope you guys found this session very, very insightful, very helpful. And if you like it, please like, share,
Subscribe as well.
Yeah. On YouTube. Now we're even on Doherty.
Yes, that's right.
So give us some comments if you found this helpful. If you have any questions, shoot to us. We'll get the other two doctors to answer for you.
Correct.
Because they have better insight compared to us regarding this matter. And until then, we'll be back next week on our next episode on Two Docs. I'm Dr. Elliot
And Dr. Ingky signing off.
and well, thank Dr. Amelia and also Dr. Aiesha for being here.